Heart disease, #1 killer of men and women, but a new survey shows many women are not finding the care they want from a female cardiologist.
Yeah, that's because only about 17% of cardiologists are women, creating a major gender gap in cardiac care.
I think a lot of women think they can communicate better with a woman doctor.
Dr. Jane Lombard is the director of a women's heart center and says the lack of female cardiologists can impact care.
If you look at the data, patients have better outcomes, better patient satisfaction, and better clinical outcomes when they are managed by women physicians or providers.
A survey by El Camino Health found 59% of women believe a doctor of the same gender can relate better to their experiences, concerns, and symptoms. That's compared to just 36% of men who feel the same.
I think a lot of times we're so focused on taking care of everybody else. Kids, the husband, the job, whatever it is.
When Margaret Cal became concerned about her family heart history,
I wanted somebody who had a really solid background in women's cardiology specifically, who wasn't just going to be like, oh, you're in your 50s, you're fine, don't, come back in 10 years kind of a thing.
she was right to be worried. Doctors discovered a major blockage, and Margaret needed a triple bypass.
Even with the stress test, they kept on like, do you feel anything? Does anything hurt? I was like, no, it's all fine. Apparently, you can be walking around with a really major blockage and really feel fine.
A lot of the women they may have some chest pain, but a lot of them complain of extreme shortness of breath with exertion, associated with nausea and or sweating. Some of them have jaw pain or shoulder pain.
Margaret urges everyone to find a doctor who will take your concerns seriously.
These things are much better caught and fixed earlier than later.
And in addition to differences due to hormones, many women also experience cardiac issues during and after pregnancy, which can be a predictor of future heart problems.